Bismillah ar-Rahman ar-Rahim. Welcome to the block of blood and lymphatic systems. This is the first lecture. It's about the anatomy of the lymphatic system. My name is Dr. Ayman Amir. I'm associate professor at the Department of Anatomy. By the end of this lecture, you are going to be able to define the importance of the lymphatic system, describe its anatomical components, and the lymphoid organs. Also, you will be able to explain what is lymph, how it is formed, and the direction of lymph flow. Also, you'll be able to understand the anatomy of major lymphatic ducts, which includes the thoracic duct and the right lymphatic duct, and to correlate the anatomical facts with their major clinical applications. So let's start. I use in this lecture these references which are available to you, and this list shows you the pages that are of interest to you concerning this lecture. The anatomy of the lymphatic system. To start with, we need to know what are the components of the lymphatic system. This lymphatic system is made of what? It is made of lymph, the fluid that runs in the lymphatic system, the lymphatic vessels, the lymphoid organs like the lymph node, and the lymphatic cells which are present in this system. So let's look at this illustration. In this illustration, this shows you the position of the heart, and this is the arterial system, and this is the venous system. So this is actually an illustration of the cardiovascular system. From the heart, you will see the arteries going out. This is the arterial system, and then the arteries end into arterioles, and the arterioles divide, making capillaries. The blood capillaries will collect, making small venules, and then unite to make veins, and this is the venous system. So at this specific point, the blood capillaries, there is leakage of fluid from the capillaries, from the blood capillaries. This fluid that leaks out of the blood capillaries will retain in the spaces between the capillaries and also the spaces around the tissues and cells. So this tissue fluid becomes the lymph. This is the lymph. And the lymph is collected by capillaries of the lymphatic system. They are called lymph capillaries. So the lymph capillaries, they collect the lymph, and then the lymph runs into the lymphatic vessels. Note that the lymphatic vessels contain valves, and the valves allow the flow of lymph in one direction towards the venous system. So the lymph runs in the lymphatic vessels and ends in the lymph ducts that drains into the venous system. So what are the functions of this lymphatic system? The functions of this lymphatic system is to return the tissue fluid back to the blood. So this tissue fluid that has leaked in the blood capillaries, the lymphatic system will return this tissue fluid to the blood. Also, the lymphatic system transports the fats from the digestive tract to the blood through the lacteals. And lastly, the lymphatic system is important for the lymphocyte development. The lymphocytes develop in the lymphatic system organs, and at these lymphoid organs, the immune response is created, which acts as a surveillance or a watch or monitoring of the condition of the body to find if there is any non-self material or foreign organism. Then it will create the defense mechanisms. So these are the functions of the lymphatic system. This is a magnified view of the blood capillary, and as you see, this is the arterial side, and this is the venule side, and here is the blood capillary. The blood capillary is leaking fluid, and the fluid is gathering between the cells and the tissues, so it is called tissue fluid. This fluid, which is also called the lymph, it is entering the lymphatic capillary, and from the lymphatic capillary it will go to the lymphatic vessels and run in the lymphatic system. So if you'd like to know what is lymph or chyle, it's another name for lymph, it's called chyle. Lymph is tissue fluid. So it is the fluid between the cells, it's called interstitial fluid, that enters the lymphatic capillaries carrying all the components of the blood except the red blood cells. If you block the lymphatic system, what will happen? What will happen is the tissue fluid will be staying in the interstitial fluid, causing swelling, and this swelling is edema, so it's called lymphedema. So blocking of the lymphatic drainage will lead to lymphedema. This lymphatic system, as we have said before, it is made of tissues and organs, and the main function is to protect the body, to get rid of toxins, waste, and other unwanted material. This lymph that's running in the lymphatic system is rich in lymphocytes. The lymphocytes are infection-fighting white blood cells. It has several types, for example, the B cells that mediate the humoral or antibody-mediated immunity, and the T cells for the cell-mediated immunity. In this slide, we are going to see the structure of the lymphatic vessels. The lymphatic vessels start as lymphatic capillaries, and these lymphatic capillaries, as I mentioned, it collects the lymph, and from there the lymph runs in the lymphatic vessels to end in the venous system. The lymphatic vessels has valves. As you see in this illustration, this is the lymphatic vessels, and you can see the lymphatic vessels containing valves that allow one-way flow of lymph. And the lymphatic valve inside the lymphatic vessels, in addition to the tissue pressure around the lymphatic vessels, all of that facilitates the flow of the lymph towards the venous system. Please note that this direction of lymphatic flow or lymph flow is towards the venous system. It is in opposite direction of the flow of the blood in the arteries, because as you already know, the artery arises from the heart and goes peripherally, and the direction of the blood flow in the artery is away from the heart. The direction of the lymph flow in the lymphatic vessels is towards the venous system and the heart. So the lymphatic drainage follow arteries but in reverse direction. This goes to the heart in the case of the lymph, and the blood in the artery goes away from the heart. In addition, you need to know that if you compare the flow of the lymph in the lymphatic vessels with the flow of the blood in the veins, you will see that the flow of the blood in the veins runs in the same direction as the flow of the lymph in the lymphatic vessels. So the flow of the lymph in the lymphatic vessels in the same direction with the flow of the blood in the veins, but it is in opposite direction of the flow of the blood in the arteries. The lymphatic vessels are present all over the body in several organs except CNS, the eyeball, the internal ear, epidermis of the skin, cartilage, and bone. These organs do not have lymphatic vessels. The lymphatic ducts, they are the largest lymphatic vessels. These ducts are two in the body. The right lymphatic duct, which is responsible for taking the lymphatic drainage of the superior right quarter of the body. Superior right quarter of the body is drained by the right lymphatic duct. The rest of the body is drained by the thoracic duct, which is also called the left lymphatic duct. So this thoracic duct, it is the largest lymphatic vessel in the whole body. It starts from the cisterna chyli, which is a sac-like structure in the abdomen, located to the right of the abdominal aorta. It receives intestinal and lumbar lymphatic trunk. and from the cisterna chyli, the thoracic duct arises and runs to the right side of the aorta, pass through the aortic opening of the diaphragm, enter the thorax, and then ends into the angle between the left subclavian vein and the left internal jugular. This is the end of the thoracic duct. The same is shown here in this inset, the comparison between the thoracic duct and the right lymphatic duct. Here it is a magnified view of the same comparison between the right side and the left side. So let's see what is there. The main thing is that we need to know the big vessels. Here we have the left subclavian vein unites with the left internal jugular vein to make the left innominate or brachiocephalic vein. This is the right subclavian vein unites with the right internal jugular to make the right brachiocephalic or innominate vein. Both innominate veins unite to make the superior vena cava that ends in the right atrium. So the lymph of the body, all of it goes through the bloodstream at the subclavian veins. What specific point of the subclavian vein? The junction between the subclavian and internal jugular. So in the right side, you can see here, this is the right lymphatic duct, and it ends at the junction of the right subclavian with the right internal jugular. And on the left side, you can see this is the thoracic duct that ends in the junction between the left subclavian and left internal jugular veins. Both of the right lymphatic duct and the thoracic duct, they receive lymph trunks before its end. So the left side, it receives the left jugular trunk and the left subclavian trunk, and then all of it unites into the thoracic duct and ends in the junction between the left subclavian vein and the left internal jugular vein. The same here on the right side, you'll see the right jugular trunk and the right subclavian trunk. These are lymph trunks. They end in the right lymphatic duct at its termination, where it ends in the junction between the right subclavian vein and the right internal jugular vein. Please note that if you disrupt or cut the right lymphatic duct, what will happen? For example, in case of cancer breast surgery, the condition is called lymphedema because there will be swelling in the right upper quadrant of the body due to leakage of the lymph in the interstitial space. In this slide, you can see the lymph drainage of the skin of thorax and abdomen, and it illustrates the direction of the lymph flow. The skin of thorax and abdomen is very important. For example, in the thorax, you see the breast, which is modified from the skin. It's a skin appendage. It's a modified sebaceous gland. And the lymphatic drainage of the breast is going to the axillary lymph node. In the operation called radical mastectomy, radical means that it removes everything that is affected. So it removes the primary tumor in the breast and also removes the lymph vessels and the lymph nodes that drains the breast. There is an important line here which is called the watershed line or level. It runs at the level of the umbilicus anteriorly and at the level of the iliac crest posteriorly. The skin of the thorax and abdomen above this level is drained by the anterior axillary lymph nodes in the front and by the posterior axillary lymph nodes in the back. The level, everything that below this level in the front is drained by superficial inguinal lymph node, and also in the back it's drained by the superficial inguinal lymph node. So please pay attention to this slide because this is an important lymphatic drainage site, and you can get questions about this direction of lymph drainage above and below the level of the umbilicus for the skin of thorax and abdomen. In this slide, you can see the lymphatic drainage of several parts of the body. In the table, you can see the lymph node cluster, the position of it, and the area drained by it. This is a very important slide. It covers many parts of the body, and you need to know it very, very well. For example, if you look at the cervical lymph nodes, it is for the drainage of the area of head and neck. The mediastinal lymph node, it's drainage for the trachea and esophagus. The hilar lymph node, it receives the lymphatic drainage of the lung. The axillary lymph node, it receives the lymphatic drainage of the upper limb, the breast, and the skin above the umbilicus, as I have said. The celiac lymph nodes, this is very important lymph node for the drainage of the liver, stomach, spleen, pancreas, and upper duodenum. Superior mesenteric lymph node for the lower duodenum and jejunum, ileum, and the colon up to the level of the splenic flexure. Inferior mesenteric lymph node, it drains the colon from the splenic flexure to the upper rectum. The para-aortic on each side of the aorta, para-aortic lymph node. The para-aortic lymph node is very important for the drainage of the testes, ovaries, kidneys, and uterus. Pay attention to that. The para-aortic lymph node, it is for the drainage of the testes, ovaries, kidneys, and uterus. External iliac lymph node is for the drainage of the cervix, superior bladder, and the body of the uterus. Internal iliac lymph nodes for the drainage of the lower rectum to the inner canal above the pectinate line, also to the bladder, vagina, the middle third of the vagina specifically, and the cervix and the prostate. The superficial inguinal lymph nodes. This superficial inguinal lymph node receives the lymphatic drainage from the anal canal below the level of the pectinate line, and also it receives the lymphatic drainage from the area of the skin below umbilicus except the popliteal area, and also it receives the lymphatic drainage of the scrotum and vulva, and this is very important. Lastly, the popliteal lymph node, it receives lymphatic drainage from the dorsolateral foot and calf, and from this popliteal region it will go to the deep inguinal lymph node, which is not shown in this table. Deep inguinal lymph node is the site of reception of the lymphatic drainage from the popliteal region. So we have covered all parts of the body. Now let's see the lymphatic ducts. The thoracic duct. If you have this thoracic duct cut by accident or a trauma or a rupture for any reason, what will happen? The lymph or chyle inside this thoracic duct will ooze outside, and it will make a condition called chylothorax, which is leakage of lymph, which is also called chyle, into thoracic cavity. So the chylothorax is a condition of leakage of lymph into the thoracic cavity. Let's test the information that you have learned so far by this question. A surgeon mistakenly cuts the thoracic duct during lung surgery. So a surgeon was doing lung surgery and by accident he hits the thoracic duct, cut it. Which of the following would be the immediate consequence of this mistake? What will happen immediately if this mistake is done? High blood pressure, low blood pressure, decreased immunity, chylothorax, or hemothorax? And the correct answer for this question is chylothorax. Chylothorax, that means there is lymph or chyle in the thoracic cavity due to cutting of. Now let's know a little bit about the lymphoid organs. The lymphoid organs are classified into two groups: primary organs and secondary organs. The primary organs include the adult red bone marrow, which is responsible for producing all lymphocytes, and it's the site of B lymphocyte maturation. The second structure is the thymus. The thymus gland is located behind the sternum, and it is the site of T lymphocyte maturation. The T lymphocytes complete their maturation in the thymus gland. These are the two primary lymphoid organs. The secondary lymphoid organs are the organs that allow the lymphatic cells to interact with non-self antigens and infections. And these organs include the tonsils, which are located around the oral cavity and nasal cavity. The tonsils trap and remove the bacteria entering the throat. The spleen filters the blood and removes the non-functional red blood cells. And the lymph nodes that are scattered all over the body, they store the B and T lymphocytes and activate the immune response. And the paired patches in the small intestine. These paired patches in the small intestine, they are associated with the digestive system, so they are called gut-associated lymphatic tissue, GALT, which is the gut-associated lymphatic tissue, which is part of a bigger group called the mucosa-associated lymphatic tissue, which is the lymphatic tissue associated with mucosa all over the body. So these are the secondary lymphoid organs. Let's get some details about the structure of the lymph nodes. The lymph nodes are bean-shaped organs. They are located along the lymphatic vessels, which are scattered all over the body. The lymph nodes contain lymphatic or lymphoid cells, which include the macrophages and the T and B lymphocytes that attack microorganisms and make the immune response. The lymph nodes has lymphatic vessels of two types: afferents, which are going into the lymph nodes and end just under the capsule of the lymph node. Efferents, they are going out of the lymph node and they arise from the medulla, which is at the center of the lymph node. These are the efferents. So we have two types of vessels: afferents going inside, efferent which is going out of the lymph node. The lymphatic vessels provide a pathway of spread of malignant tumors from the site of the origin of the tumor. When the cancer cells reach the lymph node, they may be temporarily trapped and stopped by the network of reticular fibers. However, cancer cells may continue to multiply in situ, and the meaning of in situ is at that site of the lymph node. So it's multiplying inside the lymph node, leading to formation of a secondary growth or metastasis. So that's how the metastasis occur. So we have a primary location, and this is a secondary growth or metastasis of the tumor occurs in the lymph nodes. This is a clinical case, and I'd like you to think about it and select the correct answer. The case is about lymph node infection. 22-year-old woman had a severe infection under the lateral edge of the nail of her right index finger. And pay attention to what I'm saying. Right index finger. On examination, a series of red lines were seen on the back of the right hand and extended around to the front of the forearm and arm up to the axilla. Which of the following statements concerning this patient is correct? So this is a case of lymph node infection. That woman has infection in the right index finger, and there are red lines seen on the back of her right hand extending to the front of the forearm and up to the axilla. So let's see the choices here and which one is correct. Examination of the left axilla revealed presence of several enlarged lymph nodes. This is not true because the infection in the right will not affect the left side. So this is Wrong. The second choice, the red lines on the back of the right hand were caused by inflamed superficial lymphatic vessels that could be seen through the skin. Yes, that's correct. Because we have infection in the right index affecting the back of the right hand when you see this series of red lines. So these red lines are caused by inflamed superficial lymphatic vessels, and that could be seen through the skin. Yeah, that's true. Let's see the other choices whether it is correct or not. Infected lymph from the right arm entered the bloodstream through the thoracic duct. No, this is wrong, because we know that the lymph from the right arm is drained by the right lymphatic duct, not the thoracic duct. So this is wrong. The choice D, infected lymph in the right lymphatic vessels drain into the right subclavian artery. And this choice is also wrong, because the infected lymph in the right lymphatic vessels drains into the right subclavian vein, not artery. So this is wrong. The last choice, the red lines on the back of the right hand were caused by inflamed thoracic duct vessels that could be seen through the skin. No, it is caused by inflamed the lymphatic vessels, not the thoracic duct, because the thoracic duct drains the left upper limb, not the right. And we have the condition here affecting the right. So what we have been seeing through the right hand, the back of the right hand, this can't be due to inflammation of the thoracic duct. So that's why this is wrong. Correct answer is B. The red lines on the back of the right hand were caused by inflamed superficial lymphatic vessels that could be seen through the skin. This concludes this lecture, and if you have any question, don't hesitate to ask me and send me email. My email is written at the first slide, and thank you very much. Goodbye.